I'm Heidi French, Director of Community Relations at UCS, and welcome to our annual Legislative Forum, usually a breakfast, and hopefully next year we can serve you breakfast again. I just want to go over a few housekeeping items before Lorna begins. And for panelists and legislators, please keep your mics on mute when you're not talking, just to minimize background noise. You can unmute yourself when you want to speak. Attendees, your mics and video are turned off, and you may use the Q&A feature to ask any questions. Amy Fella, our Director of Operations, will be monitoring the questions throughout the session today. If we don't get to answer your question, I will get back to you within the next day with an answer to your question. And please raise your hand if you'd like to speak, and we can unmute you to allow us to hear you. That's for the attendees. Panelists, you should have the ability to unmute yourself. We'll be recording the forum today, and it will be made available to you and publicly later this week. I think that's it for housekeeping, so I'll turn it over to Lorna.
Thanks, Heidi, appreciate it. And we're praying for a technical difficulty-free morning, so we'll see what happens. So good morning, my name is Lorna Matern, and I'm the Executive Director of United Counseling Service. Appreciate all of you being here with us today, and welcome to our staff, clients, community members, and board members. We're pleased that you can join us. Of course, welcome to our guests, Senators Dick Sears and Brian Campion. And I apologize if I missed anybody, since it's hard to see the full screen, but welcome to Seth Bongartz, Tim Corcoran, Dave Durfee, Kathleen James, Mary Morrissey, Mike Nigro, and Dana Whitman. Appreciate you all being here. And I'm going to start off this morning actually by introducing to you Commissioner Sarah Squirrell, who's the Commissioner of Mental Health. Commissioner Squirrell has met with the designated agency system every week to answer all of our myriad of questions, give us up-to-date information, and support us through the pandemic. She and her department have been true state partners through the pandemic and beyond. So welcome to Sarah Squirrell.
Thank you, Lorna. Well, good morning, everyone. Sarah Squirrell, Commissioner of the Department of Mental Health. Great to see the staff from UCS, members of the legislature. I'm assuming maybe a few board members here, but maybe not. So thank you for allowing me to speak this morning. I think now more than ever, as the pandemic stretches on, we would all agree that it is so important that we focus on the mental health needs of Vermonters. We certainly know that the impact of the pandemic will far outlast the pandemic itself, and partners like UCS are absolutely critical. We have to ensure that when our family, friends, neighbors, and loved ones need access to mental health care, that those services and supports are there. And as Lorna mentioned, it has been a collaborative effort. I think that our mental health system of care has really risen to the occasion to continue to provide services to Vermonters. And UCS has really been leading the way, pivoting to telehealth very quickly, upgrading facilities, managing PPE and the safety of staff, supporting staff as they grapple with their own personal situations in terms of managing their own health and wellness, as well as their family members. And all the while putting the needs of our most vulnerable children, youth, families, and adults at the center of our work. The Department of Mental Health, the way that we provide services across the state of Vermont is primarily done through community partnership. So we partner with many community mental health agencies and other nonprofit partners to deliver services. And if there's one thing that I've learned in my work is that sometimes we think the best way to serve the system is to optimize our part in it. And I really believe that we have to optimize the relationships between the parts to get the outcomes that we're after, which is why collaboration and partnership are so critical. And UCS continues to be a great partner to the state of Vermont and continues to emulate the values that we share, which is that our North Star of accountability is always to the people that we serve. I'm also a big fan of appreciative inquiry, which is really looking at what do we do well strategically as a system of care, and how do we do more of it? And I want to share a little bit about what UCS does well in the system of care. So I had the pleasure of reviewing the most recent agency review that was done for United Counseling Services. The Department of Mental Health has kind of regulatory authority related to the community mental health agencies. And these were a few things that UCS was noted for: having an incredible culture of caring, a strong commitment to agency mission, qualified and dedicated staff, strong leadership, prioritizing a teaming approach across the agency, prioritizing peer supervision and case review, and transformational change. I would also say that we have been able to implement payment reform at the Department of Mental Health, which has really been critical, I think, in creating a fiscal stability for the agencies across the state. And UCS has been an absolute leader when it comes to performance under payment reform. They have consistently high numbers when it comes to consumer satisfaction. Questions such as, did you feel respected when you were trying to access services at the agency? And their access to care numbers have been some of the highest across the DA network. Not to mention continuing to lean into innovation. How do we continue to do more? And I guess an example of that was their establishment of the PUC program, the Psychiatric Urgent Care Center for Children. Again, I think you should all be very proud of your community mental health agency, its leadership, and of course, the incredible direct care workers. Our direct care mental health workers are the true backbone of our mental health system. And I just want to thank personally all of those who work at the United Counseling Services. And as we move into recovery as a state, I think we are going to continue to face challenges, but I know that we will continue to rise up to meet that with strength and determination. The governor has certainly articulated key priorities in terms of our work around mental health that we want to continue to partner with UCS on. This is inclusive of suicide prevention work, of which UCS has always been a leader and a partner. Looking to strengthen our promotion and prevention work across the state. We all know, certainly Betsy knows, that children are setting long-term health trajectories in their earliest years. And the bottom line is the earlier that we can intervene, the better the outcomes. So the governor is really committed to that career-to-career educational approach that really focuses on and prioritizes the social and emotional development needs of children and to support their families. I would also say that one of the areas we're looking forward to partnering with UCS on is really strengthening care coordination, particularly for individuals who are also transitioning out of the correctional system. So how do we improve care coordination at the community level to ensure that individuals who are transitioning out of corrections, on probation and parole, back to the community, have those connections to mental health and substance use services? And certainly there is a deep commitment to ensuring that as we move towards recovery as a state, reopening schools, that when our children and youth return to school full-time, that they have access to the services and supports that they need. This is certainly an unprecedented time of change and uncertainty for all of us, but also a great time of opportunity. And I think the work of UCS and the work that we have done together really allows us to continue to shape the future of where we're headed in terms of mental health services across the state and improving them. And I think that UCS as an organization has demonstrated what I would refer to as organizational resilience. I think they will continue to lead and give those they serve hope because they will know that services will always be there. And I'm greatly looking forward to continuing to work with Lorna and her team to support where we're headed as a system of care and to work with legislators to help advance some of those priorities from a policy perspective. So thank you everyone for having me this morning.
Thank you, Sarah. I really appreciate those words and the support that you and your team have given us has been phenomenal through this crisis and, as I said, beyond. And I appreciate you being here this morning. Thank you. I know that you're welcome to stay, but I assume that you might be hopping off whenever you need to, and that's fine. And thank you very much for your support. In the world, as Sarah has referred to, actually she referred to a few things that I'm going to be talking about as well. That's how connected we are. The world is a very different place than it was since the last time we met. Our lives have been forever changed due to the pandemic, not being able to see family and friends, some losing family and friends, business closures and job losses, social distancing and wearing masks. And yet all around us in our community, there are things that we can count on. And one of those things is United Counseling Service. Every day at UCS, we are living our mission of building a stronger community by empowering individuals and families to live healthy and meaningful lives. And this year is truly a testament of our commitment to our mission and our community. The community counted on us to deliver our comprehensive system of care for children, families, and individuals living with mental illness, intellectual disability, or substance use disorder. We provided those services without missing a beat throughout this unprecedented time. The community counted on us every day, no matter the risk, to provide services to the most vulnerable in the emergency department, in therapy, through our Head Start and Early Head Start program, in our group homes, and much more. Our staff made sure our clients were cared for, even when it meant risk to their own welfare. Our Gatling House group home became a COVID positive environment in December. Staff cared for COVID positive clients while they were positive with the virus themselves. And staff from other programs who did not have the virus volunteered to cover shifts. I'd like to share with you a video from Tina Feedy, a manager at the Gatling Group Home, and Lisa, a resident, who shared their experience. Hopefully. There we go. There's no volume, there's no sound, Heidi.
Okay, let me try it one more time.
To celebrate the good things.
Start over.
And I have had my issues with COVID, but the staff here has got me through it. Can't go out, do things like we normally do. To celebrate the good things and that I have lost weight. I, did all these things. I've come to quit smoking. Reduce medications, things like that. I use my iPad a lot. That really, technology really helped me get through the bad times when I couldn't see my family. I did a lot of emailing and calling on the phone, that type of thing, and it got me through. So really helped a lot, and the staff really made it possible for me to get through that.
So working at the group home through the pandemic has been, it's been a challenge. And although with the amount of support that is available to us from the agency level and the agency leaders, from working closely with the Vermont Department of Health and with Dale, it made it easier when we did have to put in policies and procedures in place to support the individuals in a COVID positive environment. In December, we were in that situation and we were ready to go, very prepared, and were successful to support the individuals here in their homes, maintain their well-being, and get them through the difficult isolation and symptoms from being COVID positive. During that time, it continued to be a struggle as staff were also ill, being short-staffed in general, and trying to ensure that all areas were supportive. Definitely the success came from having so much support. So that way we were able to be the hands-on, but the agency itself coming together and the partners of the health department being able to really make it as smooth as possible. I think now that we are out of the woods a little bit and the light is shining because the vaccines are available, and long-term care facilities were one of the first ones, thankfully, to be able to have the vaccine. I think it gives those individuals in this setting, thinking about more hope and being able to get out of this such a restrictive type of environment. During that time, maintaining their mental health and well-being was also a struggle. And we really had to think out of the box. And I think with the help of technology and the help of having very dedicated staff that were highly trained and available to meet the needs of each individual on their individual basis, has got us to this point, and feeling really proud of the agency, the staff that have worked effortlessly, especially needing to be away from their families, most of us for several weeks during the holidays, of working in a positive environment, not seeing our children or those sort of things to keep everybody safe and still maintain the safety of the individuals living at Gatling House. It's been quite a journey, but definitely feeling, together we can get through it, learn together, support each other, and feel completely supported from the agency and state partners that, grateful to be living in the state of Vermont and being able to provide the care that we can.
Thank you, Lisa. Thank you, Tina. I want to point out that Tina really led her team to be able to provide really fabulous care to clients who are sick with COVID while they too were sick. And that's heroic to me. That's a definition of a hero. So thank you to Tina and to your entire team for the care that you provided and the sacrifice that you made. You had mentioned that, literally you couldn't be with your children and your family at Christmas and over the holidays. And that was a sacrifice that I think that you gladly made for the care of your clients. So again, thank you so much. Let me highlight what else UCS has done to serve the community over the pandemic and bring in others to talk about their experiences as well. When the coronavirus first hit our area, as Sarah actually mentioned, that we quickly pivoted to providing remote services where we could, and thanks to the flexibility of our federal and state partners, we were able to provide and bill for telehealth and telephonics. And those services actually increased by 300% from what we were providing pre-pandemic. And it's our intention and hope that we'll be able to continue to provide these services after COVID. We made sure that our clients had access to the services by providing them with tablets and phones and hotspots. We created satellite offices by providing community partners such as Turning Point with equipment as well, which allowed access to services to anyone who needed it. We partnered with SVMC to provide a rapid EAP program for their staff, as we know that healthcare workers are especially at risk of psychological distress related to being on the front lines at the best of times. And certainly through this crisis, it amplifies that. We created a warm line, which allowed a clinician to be available for anyone calling in for an urgent need to get support. Our staff provided and participated in community outreach, such as volunteering at the MRE distribution sites, offering our Superhero 5K virtually, working with the health department to provide support to seniors during their vaccination, creating webinars on topics like dealing with parental stress during COVID, and participating in chamber lunch and learns to make sure that the community knew we were here for them and they could count on us. We had to get creative in the ways that we engaged our clients safely, from offering walking sessions to delivering materials to clients' homes to make sure that they could participate in group activities, to putting up a tent to hold groups outside where we could socially distance in a fresh air environment, and writing letters as a way to stay connected with children in the mentoring program. We had to go old school and actually write letters. We were able to benefit from COVID relief funds such as the PPP loan, which allowed us to maintain our full workforce of 285 staff and provide our full array of services to 1 in 11 of your friends and neighbors. UCS provides essential care to the entire community, care that is vital now more than ever, as evidenced by a 135% increase over last year for calls for service. It is not unheard of nationally for people seeking services for mental health treatment to wait upwards of 90 days to be seen. At UCS, we've been able to offer to 92% of the individuals who call an intake appointment within 5 days. 74% of those who completed an intake saw a clinician within 14 days. Our goal is 100%. However, we are not likely to achieve this goal given the increased influx of calls for services with current limits in resources. And when we know that only 43% of all people nationally pre-pandemic living with a mental illness receive treatment for their condition, there's still quite a lot of work to be done. And the data for substance use disorder is far more alarming. Only 30% of Vermonters with a substance use disorder receive specialty treatment in our current hub and spoke system. Since the beginning of the pandemic, opioid overdoses have been on the rise, and currently Bennington County has the highest opioid-related overdoses data in the state. We responded by creating an intensive outpatient program, distributing harm reduction bags in collaboration with Turning Point, and actively partnering with the Opioid Task Force, to name a few. I'm happy to introduce you to Christine Willett, Substance Use Outreach Coordinator, Lori Vatican, Substance Use and Outpatient Director, who will talk more about our services, and Peggy, who is gracious enough to join us to share her experience. Lori and Christine and Peggy, I'm throwing it over to you.
Well, thank you. Good morning, legislators. Thank you for joining us this morning. I did want to give a few stats. I wanted to address that this is an epidemic within a pandemic, and that the accidental fatal overdoses as of November was 134 compared to 99 the year before. 89% involve fentanyl, which we now know fentanyl is in all substances. Bennington does have the highest rate of prescription drug abuse. And here at UCS, Christine Willett has been really named as the lead in addressing this epidemic. And she's going to talk about specifically what is in those harm reduction bags that we're delivering everywhere. We keep in our lobby. We do have people come pick them up for their organizations. She's doing a ton of outreach. She also delivered hub computers. She'll talk about where she delivered them to. We have been able to create and run an IOP, an intensive outpatient program, for people that are willing to let go of the substances. And we really have enough people to start a second IOP. We have been able to deliver telehealth equipment to people from all over Bennington County to access our services. And I'm excited for Christine to talk a little bit more in detail about some of those services before we chat with Peggy.
Good morning, everybody. My name is Christine Willett, and I have been delivering harm reduction kits across the community to anybody who needs them. These harm reduction bags are really, they look like a backpack that has no identifying information on it. So anybody can pick one up without having, with feelings of they might be judged by the community for carrying something around. But the bags are amazing because they include fentanyl testing strips, which is one of the highest reasons that there have been so many overdoses in our community recently and over the pandemic time too, especially. Some of the most important information that are in those bags, we have HIV information for needle exchange programs, hepatitis C. We have our treatment and recovery brochures in there. Vermont Health Link information is in there. There's MAS, sanitizing wipes, all kinds of information for Turning Point. And most importantly, there's Narcan. And most recently, the state has just given us permission to add a second dose of Narcan to the bags, which is a huge improvement because many of us know that it takes several people, more than one dose of Narcan to get to the hospital and survive. So that's one of the things I really wanted to talk about. We are bringing them to anybody who needs them. I bring them to area hotels and they put them in all the rooms because so many of our substance using people are ending up in the hotels and motels across the state of Vermont right now. And it's just a horrible thing that's happening out there. So we're just trying to save lives and these bags are doing that. So Lori had made mention that as one of the responses to this increasing epidemic of substance use across New York is our ability to actually do an IOP as a response. And I'm really loving the program that we put together because the IOP that we offer has several modalities of treatment involved in it. It's a very robust program and it's very well attended. I'm actually surprised within a couple of months we have had to start a waiting list, which is both exciting and depressing. I don't have the resources to start another IOP right now. So that means that there's people not being served. And that is very sad to me. I want to serve as many people as we possibly can. Part of my position as both outreach and emergency specialist is I get to follow people from the moment they enter treatment to the moment they leave treatment so that I can reach out to them if they get off track and help them get back on track. That's something that is new and it's been very helpful to many people because let's face it, people fall off track all the time. And sometimes it only takes a friendly voice and a gentle reminder to help them get back on track. So
Christine, thank you so much. I would like to jump in and ask Peggy. Peggy can really speak to several of our programs. And Peggy, I was wondering if you could talk a little bit about how United Counseling Services has helped you.
Okay. Well, when I went into crisis, I was immediately referred to UCS. I spent one night in the ECA at the hospital at SVMC. And then I spent a total of a week at the Battelle House. And then at that time, I entered the IOP program, which was extremely helpful because it gave me structure and all kinds of people and support from UCS. Because at that time I wasn't working, so it was extremely helpful to have the the support and the camaraderie with the people in the IOP rooms.
Peggy, thank you. And I'm also wondering if you could speak to, so you talked about us holding you for a week at Battelle. And one of the things that I really wanted the legislators to hear today is that we really need recovery housing. We really need rehab, right? So people are not getting well because they don't want to leave their children. And they don't want to be sick. And the message has to be out there that those things don't have to happen. We have maintenance medication. When you decide you don't want to use, we can help you. We can get you where you need to be, but also holding you. How important was it, Peggy, that you were held during the time of your crisis so you were able to kind of relax and just focus on your recovery?
Yes, I live alone in an apartment, and I had been experiencing extreme anxiety for weeks and months. And then I had a herniated disc. in September. And it was really hard and confusing to get relief from that extreme pain. And it was hard for me to be home alone. It was difficult to sleep. It was difficult just to be in my own skin. And Battelle House, I went there for essentially a weekend, and then went home really because of insurance reasons, because I couldn't afford to stay there and not be covered by insurance. So I went home and it wasn't going well. And I saw Lori for a session, and Lori and Ethan, another UCS employee, got me right back into Battelle. I went home, got some clothes, and went back to Battelle for 5 or 6 days, and it was extremely helpful. And that at that time I was going to IOP, and I just received a lot of support and help that I needed. And when I left, I felt, yes, I'm ready to go home and I can do this.
Thank you so much, Peggy. Thank you so much, Christine. Back to you, Lorna.
Thank you very much. I think there's a question, but I'm not sure if it needs to be asked, answered.
Good morning. I will share. Beth Wallace wanted to thank Christine for providing the harm reduction bags to Head Start. They were given out at registration to the families, normalizing the need for the additional resources, and given out at Veggie Van Go. Pandemic was a silver lining, as pre-pandemic there were more barriers to getting Narcan into the hands of the people that needed it.
Great, thank you, Amy. And thank you both, Christine and Lori. Thank you, Peggy. I think it's so important for folks to hear how recovery and support and treatment has impacted those who have lived experiences. And so I really appreciate your courage to come on and share your story. Thank you, Peggy. And providing adults and children with the right crisis mental health services is critical to reducing dependency on emergency department for intervention. This has been particularly important this year as the hospital prepared for and responded to the COVID crisis. As a result of reorganization to increase our mobile crisis capacity, we contributed to an overall reduction of ED utilization for mental health by 18%. And our psychiatric urgent care for kids, or PUC program, helped reduce the pediatric utilization of the ED by 40%. However, our emergency services team has experienced a 70% increase in crisis assessments and interventions over last year. They have seen an increase in suicidal ideation and attempts. The worried well can no longer cope, and elders are feeling greater isolation and hopelessness. To further add to the stress, the number of beds, of crisis beds across the state has been reduced by 50 because of COVID mitigation and staffing issues. The demand for services and the lack of resources has resulted in an increase in ED visits locally as well as across the state. And I'm more afraid that we're losing some ground on our work towards decreasing ED utilization. Please welcome Jason Fleming, who's the Assistant Director of Emergency Services, who will talk more about crisis services. And perhaps, Jason, if you wanted to, and you might already be doing this, is talk a little bit about Battelle that Peggy referenced.
Good morning, everybody. Thanks for being here. Peggy, it's so good to see and hear from you and see that smile on your face. That's made my day. Yeah, it's, my name is Jason Fleming. I'm the Assistant Director of Crisis Services, and I manage our crisis facility and our crisis services. This is a 6-bed unit where we put folks here who are in crisis for a brief stabilization period. Due to COVID, we're now a 3-bed unit because our rooms are double occupancy. So as Lorna talked about, You know, there's inpatient beds across the state that are closed. So the demand has never been higher, and our resources, at least in the recent past, have never been smaller in terms of being able to provide beds for people who really need that level of treatment. So we've had to be flexible. That's been the number one thing. And this team and this group have been here in this building and on the streets and in the police station and in the emergency room since the day this started. And, you know, we've had to utilize technology at times, whether it's iPads and phones for assessments in the ER, because, you know, we have to keep our staff safe as well. And it really has increased our need to be mobile and meet with people where they are. We've been able to secure a grant from the state for a mobile crisis van that hopefully we'll be getting this week or next week, that we can outfit with go bags and sensory equipment and all kinds of things. And the director of emergency service, Dr. Al Yarif, we talk about it often, and it will provide us that ability to really be that community presence, literally out on the streets. And if we see somebody, scoop them up and see how they're doing, and get them an assessment or get them to a group. So that will really help strengthen our need, or, you know, help strengthen our mobile program, which is a priority for us. You know, flexibility has been the key. And since this started, the number one thing that has impacted people is the effect of isolation. And whether you're a kid when you're a kid, your only job is to be with your friends. And that hasn't, you know, that's been interrupted. Laura made reference to, you know, the elderly population. I can't tell you how many, you know, elderly folks that we've seen, especially widows or widowers, that, you know, they were doing okay. They had the support of family. They had the support of some friends. They had some community interaction, whether that was their church or different resources in the community. And when COVID hit, a lot of that went away. And thankfully, we're starting to get that stuff back again. But these are folks that we would very rarely encounter in crisis, that, you know, make a statement to a family member, and it's not just a statement, but they're losing, you know, their passion and their desire to keep fighting just to continue to be alone. And it's really, it's something that I've never seen before. In that comes amazing determination and strength to continue to try to help those folks. And our team has been great. I would like to thank our partners at the Department of Mental Health. They are great advocates for us and for our clients. When we do, unfortunately, have people that have to wait for a bed for a long time, it's great to know that we've got those partners that we can rely on. So yeah, we're continuing to grow a relationship with law enforcement. And like I said, it's great to see Peggy, and it's great to see some of those instances where we're encountering people from the beginning of this, and what we do in crisis and what we do at Battelle is part of their journey. And then we send them on to the next part. The key, of course, is being able to have access to that next part, whether it's beds at an inpatient mental health unit or at a rehab or whatever that may be. It's having those resources, and we certainly need them. So thank you, everybody. Thanks for attending. I really appreciate it. Thanks.
Thank you, Jason. Thank you all for your work too. I know that there were plenty of times where you donned full PPE, which is for anybody in the medical who's never donned full PPE is quite the process to be able to show up in the ED when you needed to, right in the middle of it all. And you also took many risks to your own physical well-being, and you have an amazing team. So thank you very much. Head Start and early Head Start remained. Yes.
We did want to share Sandy's experience of using PUC.
Oh, yes, thank you. I'm sorry. Thank you for reminding me. So we do have a video from Sandy Madison, who is a worker at UCS and also a parent who accessed PUC. So go ahead, Heidi. Thanks.
Morning, everybody. My name is Sandy Madison. I work at United Counseling. I am the coordinator for the community support in children's and families. I just wanted to share a personal experience that I had with you about our new program. It's called PUC. I have a young gentleman that I adopted when he was 4 years old. And he's my son in all my heart. And he was starting to have some difficulties in school. Some of it appeared to be behavioral, and was not having a good time. And I was starting to get phone calls from the school because he was getting dysregulated and not able to regulate himself to be able to get back to his curriculum. I got a phone call one late morning one day while I was at work from his school, stating that Mitchell was dysregulated and was being combative. And although this didn't pop out of nowhere, because I think I knew that there was something going on with him, my first thought was to go to the school to see what was going on. And I was actually in supervision with my supervisor at the time. And she made the suggestion that I let it take its course and give Fess a call, which I did. Fess went to the school, helped him get regulated. They brought him to PUC. They worked with him that day and learned who he was and helped me figure out what some of his needs were. And he was able to return to school the following day. Along with that, during that day, we were also able to get connection with our medical director and the psychiatry to work with some medications and stuff. And it just really turned things around very quickly for us. I went right into panic mode when this happened because I'd never been in that position. I've worked with a lot of parents that deal with this, but I've never done it myself. And even though it's something that I'm familiar with, as a community support worker, I froze and didn't know what to do for my own child because it's a totally different situation when it's you and when it really hits home. The people in PUC did a fantastic job. We got connected immediately with UCS as far as getting Mitchell in PUC. And we've progressed from there now to where Mitchell is been diagnosed with autism, and which was the key thing really to find out what was happening and what was going on with him. And I'm just so grateful that PUC is there because as a person that's done this job for a while and also been a foster parent in another life, I saw immediate results, immediate help, immediate caring, and immediate understanding. So any kind of trauma that could have resulted from this was avoided. And it's trauma that I see happen to kids every day. And I'm just very, very thankful and glad that the program is there and think that it has a great use in our community. So thank you.
Thanks to Sandy for doing that and also sharing her experience. Mitchell's lucky to have her. So Head Start and Early Head Start remained open specifically to provide care to essential workers and continues to be open so parents can remain in the workforce. We know that greater accessibility to quality early care and education enables working parents to work rather than to worry about whether their children are well cared for. And despite the constraints on construction associated with state COVID mitigation mandates, we are excited that our new Head Start, Early Head Start Center at the Rec Center will be open in the spring, which is certainly a bright spot. And if you haven't had the opportunity to drive by and see the exciting build, not to worry. Betsy Rathbun-Gunn, our early childhood director, I'm sure has some pictures to share among other things. So Betsy, why don't you talk about Head Start and Early Head Start?
Great, thank you. And good morning, everyone. It is really great to be able to share with you about our new project. And I'm going to show you some pictures in a few minutes, but please take a moment to drive by. It's really, really a significant improvement to the rec center and to the community. I would like to first start with a shout out to all my wonderful dedicated teachers and staff that really did provide excellent childcare during a very challenging year. We were one of the first Head Start programs that reopened only a few weeks into the pandemic. We continue to provide services to infants and toddlers and preschoolers throughout our community. And this has really helped all of our parents be able to continue their jobs, working in very essential care positions in the hospital and nursing homes and grocery stores and throughout our community. So before I begin to show you pictures, I also want to do a little shout out for H171. This is a bill that really will make a difference to our communities. It will provide enhanced eligibility for childcare for families and training and support for staff. So I hope that this bill will get your support, and I didn't want to miss a moment to be able to put that out there for everybody to hear about. So let me show you some photos of our new facility. So this is the new Spring Center, and we are going to open this spring. We are excited to be able to share this building with the town of Bennington and the YMCA. And it's been a journey, that is for sure. So we started with our groundbreaking back in October 2019. I don't know where the time has gone, but we have continued to build through some very challenging time. We were so pleased that the governor came down and was able to help us with the groundbreaking, and I'm sure he will be here for the ribbon cutting sometime this summer. So we first had to start by building our wonderful new basement. And this basement is critical because it's allowing us to be able to have access to the lower rooms of the YMCA and be able to provide more availability of space. So it took many months to build this basement, many months. It felt like all we were doing was not building up, but building down. But it really was a worthwhile part of this whole new facility. We are having 5 new classrooms in this facility. We will have 2 preschool classrooms and 3 infant toddler classrooms. And it certainly is a dynamic building, and we are so pleased with the way it's coming together. This is part of the basement on the left. This is where you're seeing also where our elevator will provide accessibility and access to the lower rooms of the rec center there to the left. And this is our new lobby coming into this facility. It's bright, it's light, and it will also provide a great space for lots of different activities in this new community center. So this is what we're calling the great room. It certainly is a great room. It will provide space for movies, space for community events, space for after school care. We see this room really being used for a variety of different great activities for the community. On the left is what we're calling the Great Hall. Hard to take a photo of this, but it's a wonderful curved wall that will have a magnetic art installation on it and will provide for both science and art activities. We are really thankful for the support that we have gotten for this facility from a variety of different funding sources. Obviously, Head Start was our major funding source, but we've also gotten support from USDA, from the Community Development Block Grant, certainly from the town of Bennington, and also from Make Way for Kids. It's been really a community endeavor to make this happen. This is one of the classrooms. It's in its finishing stages. We're actually getting close to picking out paint color, and we will soon be painting. This was a farm to school grant that we received that will allow us to have a very large walk-in cooler and freezer. If you know the site of the rec center, it has wonderful community gardens, and we hope to participate in those community gardens and be able to store food for both the community and for our site. So this has been also a wonderful addition to the programming that we hope to offer. A playground. Can't have an early childhood center without a playground, right? So we have 2 playgrounds on this site. We have one for our infants and toddlers. This is going to have a wonderful trike track around it. And one of the stories I like to tell about this playground is around the trike track, we were thinking about, we have different signs for kids to yield and to stop and go one way. And the provider of this said, well, would you like a little gas station pump? And we talked about that and said, wouldn't that be cute for the kids to stop and gas up? And then I said, who is using gas these days? We want an electric charging station. So they actually went back to California and redeveloped the gas station to now be an electric charging station. So again, this will be completed this spring for our kids and our community use, because this will be a community playground after hours. And we also have a preschool playground too, over in the corner, that we're pleased to be able to offer the community. And it will be a great place for kids to play. So this is the front of the building. It has really changed the whole feeling of the rec center to being much more of a community center. And we're really excited about being able to offer that to a variety of different programs, not just to UCS. And this is a great side of the building. It really shows all the different classrooms where kids will be able to call these sites their home for many years to come. And we love the colors. Jeff Goldstone and Jack Byers have been the architects on this project, and they have been really so helpful. So we are excited to open in April. It just feels like a few weeks away. It will be just a few weeks away. And hopefully this summer have a ribbon cutting. So you can see from UCS, we continue to build a stronger community. And I just want to say thank you to everybody who's made this possible. This has really been a statewide, community-wide event, and I look forward to showing it all to you in person.
Yeah, we're very exciting. And it's very exciting to get closer to opening. So we hope all of you will be able to join us for our ribbon cutting, whenever that might be. And hopefully it'll be a gathering rather than a Zoom experience. But it's very, very exciting. So we are proud of our response to the pandemic, as well as our capacity to continue to grow, innovate, and create through it all. Many thanks to our partners, because we know we can't do it alone, to the SVMC staff who provided our staff with COVID testing early on and made sure our staff were vaccinated, to the health department who helped our staff understand the vaccine and feel comfortable, the Department of Aging and Independent Living who supported us through our COVID positive environment, and to many others, including Sarah Squirrel, who you heard from earlier. We have presented examples of ways the community has been able to continue to count on us through these trying times. I'm not as confident, however, that the community can continue to count on us in the future without significant investment in our system. A mental health and substance use tsunami is fast approaching that will have ripple effects, the scale of which we have never seen and will last for years. Now is the time to invest in our system of care so we can respond to the surge in demand for community-based mental health, developmental, and substance use disorder services. Now is the time to invest in the developmental services to address the growing mental health needs and homelessness of this population. Now is the time to invest in mental health, substance use disorder services to address increases in acuity and demand for outpatient clinical care. Now is the time to increase funding for case management for elders, homeless population, and people involved in criminal justice system. Now is the time to invest in the workforce to reduce significant staff vacancies and high turnover by achieving market rate compensation and building predictable rate increases that align with state employees, healthcare workers, and education sectors. Now is the time. I'd like to hear from our panel of legislators about the work that they are doing to support our community and how they are investing in our system of care. I know that Dick had to jump off, so I wonder if we could start with you, Brian, because I know you probably have a class to teach or something to do soon.
Great. Well, thanks for having me, and thanks everybody for your absolutely incredible work. And I'll try to cover some stuff, a little bit of Dick's work also as it relates to appropriations. I'm Brian Campion, State Senator for Bennington County and Wilmington. I serve on Natural Resources and Energy, and I'm still relatively, a couple months in, the new chair of Senate Education. And a few of our things certainly, well, a lot of it in both committees overlap with the work that you're all doing. We just sent to appropriations our recommends for this upcoming expedited budget. And just so everyone knows, there is going to be our regular budget, but we are putting forward an expedited budget as well that different committees are weighing in on with regard to what we see as some of the priorities related to our jurisdiction of policymaking. And for education, summer is going to be key. And we put forward a financial recommendation to make certain that, you know, children in Vermont have summer opportunities. And so it's if we, you know, get the money that we're suggesting, it's a rather huge increase to making certain that a number of different things can happen, that summer camps can expand, that new summer camps can open, and that families have access to, you know, to these opportunities. And by camps, I mean broadly after school programs, educational opportunities, where families feel in their community they need to, they can put and take advantage of these dollars. What we're really trying to do, overarching goal, is to bring young people back into the fold, back into community. We also recommended an increase to the Agency of Transportation, Agency of Education, to reach out to those families through the districts of families that have really been, for lack of a better word, truant. They have disappeared. They're off the radar. They're in our community. They're in the Northeast Kingdom. They're in Central Vermont. Children that have not sort of been in touch with school, nor have their families. And so, you know, what we're really working hard to do again is to bring these families in. And one of the reasons we want these dollars expedited is so that families can and programs can really prepare for the summer. The other big piece for us has to do with access to higher education. Again, we did put a recommend to expand access to higher education, particularly right now. And I should mention, everything that I'm talking about is related to one-time federal dollars. So these aren't ongoing dollars. These are one-time federal dollars that are coming in that we feel we want to use, again, for these particular issues. As it relates to CCV and access to higher ed, some of you may recall the McClure Foundation gave all graduating seniors last year a free class at CCV. That was an incredible success. We'd like to expand that program if possible. Could we, for example, give it not only to seniors, but also include our state colleges, not only CCV, Vermont Tech, you know, really get all Vermonters out there taking 1, 2, or 3 classes, you know, to, again, either get started in terms of their first time, you know, taking a college class, or maybe for some Vermonters, it's increasing their skill base or enhancing their skill base or developing a new skill base. So that's another priority we put forward. And then third is literacy. One of our big concerns in Senate Ed is our low literacy rates. You know, we are looking at roughly 50% of third graders are reading at grade level. We suggest we make a big investment to get teachers trained. We've heard from teachers that have gone through elementary school programs that have either come to this state or studied it possibly in this state, and they didn't feel prepared to teach reading and writing. And so we really want to make a big investment on that front as well. I can't agree more with what you've said around mental health supports. One of the things that our committee is also looking at partnering with the Department of Health on is making certain that families, children, parents, friends know the signs of depression and suicide during these incredibly difficult times. And we also suggest an appropriation where the Agency of Education would work together with the Department of Health to really reach out to all Vermonters to make certain that they have access to where they can find resources locally, and really help to address some of these feelings that, of course, understandably, our youngest Vermonters and all Vermonters across the board, all different ages, are feeling during this difficult time. Those are just a few things I would say that we are working on. With regard to natural resources and energy, we're making a commitment. You'll also likely see in some of these one-time federal dollars a big commitment to weatherization, particularly for low-income Vermonters. We know weatherization saves people money. Betsy's good point on climate. It also, helps our fight against climate change, and just makes for a healthier environment to live in. I think those are the big things. I should mention that one of the conversations we have had in committee, even though it's not really our jurisdiction, is how can we work with the Department of Health, work with others to start to pay off and help those who are coming to Vermont or want to come to Vermont and be mental health professionals. We're worried about their student debt. Same with teachers. We know that these are two areas that need a lot of support in terms of financially helping them to sort of move away from that college debt that they're carrying. They're not professions that pay a lot. So that, I would say, is also on our mind. I don't know if it would be a one-time funding opportunity, preferably a long-term funding opportunity, but that's something else that our committee is talking about. And just finally, as it relates to federal funds, and I'm saying a little more because I'm trying to cover for Dick a little bit here, we have had a massive influx of federal dollars. And it's been incredibly helpful to all of us as we've started to come out of a little bit of the pandemic. So I would also say that what I'm hearing, there will be more federal dollars coming, a lot, particularly for education. I would think some of those would overlap with mental health. And I would just suggest, as I'm sure you're all doing, work closely with us, work closely with your partners in Montpelier to make certain that you know what's coming in and how it's being distributed, and play as much a role in that as possible. So sorry if I went on too long, but just wanted to give you a little bit of an update. And I'm here until about 9:30 when I do have to teach class.
Thanks, Brian. Appreciate the update. You talk about education and regarding suicide and depression. We also provide mental health first aid training to community, and that may be something to think about as you plan and how you are going to help people understand signs and symptoms of depression, is perhaps bringing in mental health first aid, which is already offered through the entire state through the DA system. So something to keep in mind.
You're probably aware of this. We did the state received a large grant for suicide prevention. I suspect some of those dollars will be used for this kind of thing. It's essential. There are certain things many things we don't want to look back and see having had happen. So this is all preventative, and hopefully we'll make some strides in this regard.
Great, thank you. Tim, how about you? We have to share.
Sure. Yeah, just had to unmute there. First of all, thank you, Lorna. It's great to come to these meetings. Just give us an idea of the valuable work that you and your staff does, and you put Bennington in a better place for the work that you do. Brian hit a lot of things that sort of that I was going to mention. If you look at the federal dollars, it seems like it's coming monthly. That's coming our way. With the bad, it's doing a lot of good. It's freeing up our state dollars so we can shift them around to focus on things that really brought us, what COVID put a spotlight on during this pandemic. And if you look at the things that I think that really brought to the forefront, it is, your mental health, your substance abuse, lack of broadband, those things. I think when these federal dollars are continuing going to flow, because Congress is in the midst of passing a $1.9 trillion package. I'm not sure what Vermont's cut of is going to be of that, but that's going to free up a lot of things. Hopefully, that's going to address issues that United Counseling has been pushing for over the years, and I'm definitely on board of revamping our child care. Year after year, we've sort of pecked away at the outside of trying to improve that, but we really need to do an overhaul to make that more affordable for your average family to afford. Because right now, families are decide whether they want to work or stay home with a kid, and I think that's a wrong way to go about doing things. So we really need to create a system that funds childcare, and hopefully we can really have serious, conversations about that with this new influx of money, even though it's one time, but hopefully that will get off the ground. But as far as the legislature as a whole, the way I look at it, we're heading into halftime. The crossover date has been set for March 12th by the House and the Senate, and that means all bills on both sides have to be out of their committees for the other body to consider. So over the next couple of weeks, you're going to be seeing, major pieces of legislation, and hopefully they will entail, like I said, healthcare. It will entail broadband. You're going to see a big thing about the teachers' pension funds. That's sort of, we got to stabilize that fund. It's sort of getting out of hand, and we need to, bring that back in, rein that back in, those costs. So, I think those are some of the bigger issues that we're going to be seeing over the next couple of weeks. As far as my committee, I serve on the House Transportation Committee, and with our budget, we did see an influx of federal dollars. We saw a huge influx to the public transit sector. Back in December, there was another upping of federal funds. We received $26 million for public transit. A lot of that went back to the local providers to help them offset their loss of revenues, due to COVID. We're able to purchase more electric vehicles. That's one of our priorities as a committee, is trying to get away from the fossil fuels and concentrate on the EV sector. So there's a lot of programs in our current bill to have EV incentives for people to trade in their older, less efficient vehicle to buy an EV. So we're, those are the things that our main focus on transportation is EV, and then just general funding overall. It's our budget is $680 million, and there's so a lot of your regular programs. I've got a huge bump up this year, whether it be your local programs as far as Class Town Highway Aid or Class 2 programs. They've seen a bump, and so we're sort of pecking away, and I guess I'm rambling a little bit, but I'll leave it at that. And again, thank you for all the work that you do and continue to do.
Thanks, Tim. And thanks, Tim, for always attending year after year. Really appreciate that. Is there anybody that has to leave shortly that wants to hop in? Mike or David or? Okay, Mike, why don't you jump in?
Thank you. And I will echo a little bit of what others have said. I really appreciate the work UCS has done. It's challenging, or it can be challenging work, certainly at any time, and it's inspiring to hear how well things have been managed in light of the pandemic. So I'm on the Commerce and Economic Development Committee, and the piece of work that isn't in our title, but is a real big piece of what we do is workforce development, and that's probably where there's the most applicable crossover with some of the things we've discussed today. Similar to Tim and Brian, our committee's been reviewing a lot of these one-time budget spends and ranking them in terms of priority. And I can say that the workforce end of the budget spends that had come to our committee were definitely the things we gave the highest priority to across the board. Everything from increased programs providing certification trainings, workforce trainings, college opportunities like the free CCV classes that Brian was referencing. So we're very focused on the workforce development, which has been a big issue prior to the pandemic, and we see as being even more important as we eventually emerge from the pandemic and try to get folks back to work and get employers back to full capacity. And in terms of the child care bill that we've been discussing as well, if we're going to expand access to child care in Vermont, we're only going to be as able to do that as our workforce is able to meet that new demand. So although we have not started our specific work on that bill yet, when it comes out of Human Services, that is going to be coming to the Commerce Committee, and you know, our next focus is the workforce development end of that bill. So again, a lot of work around workforce and some opportunity with the one-time spend, and then some important long-term planning beyond that.
Great. Thanks, Mike. Nice to see you. Thanks for coming. Just thinking about a free CCV class for early childhood educators. How's that?
I like
it. David.
Thank you. Good morning, Lorna, and everyone else who's presented this morning, and everyone else who's watching and whose faces we can't see. I understand there's another group, and it's nice to have the chance to hear from you all this morning and just to say a few words. I'm David Durfee. I'm a representative from Shaftesbury and serving my second term in the House. I was last year, first session, serving on the Healthcare Committee, so I had the opportunity to frequently hear from Commissioner Squirrel, and it was great to hear her saying to you all what she often had to share with our committee, the work, the wonderful work that you do. She mentioned, and then several other folks here have mentioned today, the PUC success of the PUC program. We heard about that 4 or 5 times last year. It kept coming up as an example of the good work that was happening. So another thing that you can all be proud of, that's made its way to Montpelier and is part of the success story. Just a couple of things that I wanted to mention. 171, H171 has come up. Betsy, you mentioned it. Mike just alluded to it. It's got broad support in the House. I think perhaps everyone from the delegation who's on the call, House members, have signed on as co-sponsors. So nothing's easy, of course, but that's a good indication that there's widespread support. I've got a couple of other bills that I'm just going to mention that I've put forward. H104 is a telehealth bill that specifically, when we're still in an official state of emergency, and it's allowed for an expanded telehealth that many people would like to see maintained and continued after the pandemic is over. And I know that there's work being done on that in the healthcare committee. My bill specifically would allow mental health counselors who are out of state to see patients via telecommunication if those patients are in Vermont. And that may be something that some of the staff, UCS staff, would be able to take advantage of, perhaps. Let's see. I'll don't want to take too much time. Broadband has also come up, and there's not a bill yet with a number on it, but I think this week we'll be getting a bill out of the Energy and Technology Committee that really is doing some interesting things that won't solve the problem overnight, but will help us get into a place where there's actually a solution looking a few years down the road to really expanding the reach in Vermont. And it's a tough issue to solve, given that the federal government really has jurisdiction over telecommunications, and it's been hard for every state. Vermont is not alone, obviously, there. I'm this year on the Ways and Means Committee, so we're not doing policy work directly related to what you all do. We're responsible for figuring out a way to pay for it, of course. The federal government has been a big force in the last 12 months in bringing revenue into the state, and we're hearing the committees in both the House and Senate that deal with revenue. We're going to be hearing a meeting with Congressman Welch on Thursday to try and get a little better sense of what the two programs, I guess the one from December, the stimulus and relief package, and then the upcoming one, what specifically dollars are going to be targeted to, because I think it's much more targeted than the CARES Act money from last year. I'll stop there. Thank you.
Thank you. Nice to see you, Dave. Thanks for coming. I think we have Mary Morrissey on the line.
No, I don't know. Who is the cell phone that has signed on, ending in 6379?
That could be me, Dane Whitman.
Okay.
Oh, hi, Dane.
Can you?
Great.
Hi there. Can you hear me?
Yes.
Hold on, Mary.
Would you like me to start?
Sure, that'd be great.
Great, fantastic. And I apologize that you can't see my face. Some real connectivity issues this morning, hopping back and forth between computers and phones and things like that. So Dane Whitman, representing Bennington District 2-1. And thank you all so much for your work. I just adapting to this pandemic and continuing to provide the services and the sacrifices that some of the stories that we've heard. Just thank you all very much. I serve on the Human Services Committee, so I might be able to dive a little bit deeper into some of these issues. We do know that one-time funds are coming from the federal government, even just from being passed back in December, working with mental health, substance use prevention, and child development. But hearing from members of the community, and similar to what you said today, even after we reach herd immunity and kind of deal with this pandemic, it seems like the trauma that's resulted isn't going to go away in the near short term. So really looking at how can we build that capacity for the long term has been something that I've been interested in with the Human Services Committee. So one basic thing is looking at the basics of a cost of living adjustment being factored in to our yearly budget. Right now, it seems like a bit of a one-time thing where we look at basically adjusting reimbursement for community-based providers year after year after year, and it's kind of a hit or miss. So we're really looking at building that into statute and having that be adjusted for inflation year by year. That's a bill that we're looking at right now in Human Services. Another component as far as just compensation, we've learned that, or I've recently learned that master's level clinicians working for community-based providers like UCS aren't being compensated as much as their peers, even in state government. So we did budget recommendations to the Appropriations Committee just at the end of last week. And part of that was beginning to bridge that gap so that people are compensated commensurate with their peers. Another thing, and I'll just keep in, I do want to note on that topic is that there are many needs across the state, and still having some uncertainty about what appropriations we'll be working with. We made a decision as a committee to just present all of these needs and not prioritize one issue being more important than the other coming out of the Human Services Committee. So while we made these recommendations, I just want to kind of give that disclaimer. Another part of that recommendation was increased support for recovery centers, just an increase in their base funding, seeing how important they are as far as our long-term substance use treatment plan. And just something on the horizon is that ADAP, after having conversations with the Division of Alcohol and Drug Abuse Programs, they're looking at a substance use treatment redesign, which is exciting, but also raises a lot of questions as far as what it will mean. It's essentially looking to integrate the hub and spoke model more into our healthcare, more into our residential potential, and more into recovery centers, and kind of looking at it more as a value-based as opposed to fee-for-service based. This is very early stages, so I just look forward to continuing to have conversations about potential reforms in ADAP. As far as child development, I will say that H-171, the child care bill, is the priority in human services for this week especially. We're probably going to be working on it nonstop with the hopes of getting it out by this Friday so that I can make it over to Commerce and get through in time for crossover. Another thing as far as child development is looking at our friends at the Sunrise Family Resource Center reached out about the CIS Children's Integrated Service. Case rates are increasing significantly and the reimbursements aren't keeping up with the cost of services. So again, both with childcare and with CIS, looking to just make sure that the reimbursement that's provided keeps up with the cost of care, keeps up with the cost of services is something that I feel like is really important. And hopefully we can just increase access and quality of these services through that over time. I think that is it for me as far as updates right now. Just thank you all so much for the work that you're doing again, and look forward to keeping in touch.
Thanks, Dane. All of those things that you talked about are absolutely issues that we are concerned about. You had mentioned the ADAP redesign, which we've been a part of those conversations. And I guess what I would throw out to you is the designated agency system and preferred provider system has been able to provide really great prevention, treatment, and recovery services. And our hope is that the system will be strengthened rather than, say, bringing in outside for-profit individuals to come in and provide the service or anything to that effect. And who knows where it'll land, but certainly I think that we don't necessarily have to look any further than our own backyard for the expertise that is necessary to provide the service. So just to throw that out to the group as well.
Great. Thank you for the feedback.
Sure. And I think Mary is on the phone, and then love to hear from Dick to close us out. So Mary, if you're on.
I am. Can you hear me?
Yes, we can.
Okay, great. I'm Representative Mary Morrissey, and I sit on institutions and corrections. And so in starting the meeting with Commissioner Squirrel this morning, Commissioner Squirrel is quite often in my committee, though our committee, we deal with the capital budget, kind of the bricks and mortar, but also policy within within that structure as well. So we've been working on, and first of all, let me step back. We have a 2-year budget of almost $130 million that we deal with. So most of what we've been looking at the beginning of this session is we are in the process of redoing a 16-bed secured residential, which used to be the Middlesex Treatment Center. And that is going to be placed on the site of where Woodside used to be. And that, for those who don't know, though I'm sure everyone does on this at this meeting, Woodside was for the intense cases of our youth, troubled youth. And that, first of all, the building was antiquated and not set to provide the treatment that was really needed. And Middlesex, that facility was becoming antiquated and not secured. And it was, at the time when it was built, was supposed to be a, I guess I would say how do I want to put this, for a short-term time. So now we are going to be building the 16-bed secured residential treatment center on the site of where Woodside used to be, demolishing the Woodside building that would not be adequate for the 16-bed residential secured residential. So those are important pieces. I think as we're going forward in all of our conversations, we're definitely looking at the treatment side of what we're doing, so that it's not just a holding place to secure folks, but there are the treatment components that are crucial in supporting the citizens in the state that need these kinds of treatments and support. So that is, and then also we're looking at what was the Woodside, it was Woodside for troubled youth. We're looking to downsize the facility, and I don't always like using the word facility, but the center that will help to provide supports for our most extreme cases with troubled youth. The one thing I will request from United Counseling is that we can have further conversations as this rolls out, because as you are all aware, Woodside at one point housed quite a number of youth from around the state, and these were the more extreme cases. And so in downsizing, what we're looking at to support our very extreme cases of troubled youth, there is more talk of having programming within our communities. So I would love to have that back and forth conversations with you folks as this looks to be rolling out, as to also what is needed here locally and what things you feel you can do and things you can't do, because it is important. I think I always get a little bit challenged or a little bit asking more questions when it's looked to go back to the community. And yes, to serve our citizens, we'd like it to be more of a home-based situation for residents. But I think we end up putting so much more on the backs of all of you who already have overflowing plates full with with capacity as well as the needs to be able to provide these services. So I would love to have further discussions with you on that. Let me see. We are also right now, it's in the stages of going forward. We've been talking about corrections for a number of years as to how we are looking to what our facilities for corrections will be across the, across the state. And I think it provides, when we hear that in our corrections, our numbers have been going down as far as those incarcerated. But we also have to look at services that we're doing to provide for those who are incarcerated, the services and the programming before they leave the correctional facility, to be able to be successful being coming back into our communities. So right now, we are focusing on, and we're working on the plan for the antiquated Chittenden Women's Correctional Facility, which is up north, and we are looking to, within that facility, also, as I was just speaking about, having a transitional treatment center kind of within it as the stepping stone for women coming out of a correctional facility to have not only the programming they need, but also some other workforce types of, whether it's in regards to having a certificate that they've gone through some programming that would help them when they get back into our communities as possibly finding work or that. So that has been, with anything we're talking about, with any of these types of facilities, it is truly looking at those stepping stones and transitional pieces that will help to secure whoever is coming out of with whatever facilities they're coming from will be able to be hopefully successful being reconnected in their communities. That is a huge focus. We also have been discussing a great deal about justice reinvestment. We've voted a bill last year. We are still working with the Senate in regards to some of the important pieces there. And that's where we're wanting to see where we can have less incarceration if that's possible. And in order to do that, the programming that's needed, and again, those transitional pieces that folks would need to have to, again, be in our communities and be successful. We are dealing quite a bit with the different state buildings, but also our schools and other buildings across the state in regards to as what we have dealt with COVID, with the systems, the ear system qualities within schools and different buildings, in our courthouses and other pieces. Let me see. I also certainly want to say that I'm very much in favor of the H-171, the child care bill. though I wasn't able to in time get on as a sponsor, that is something I truly support. Also, we have talked with, certainly put our, from our committee, the pieces that are important for us and to appropriations. We all dealt with that the last several weeks of getting our priorities to, to appropriations, so that hopefully those will be included, within their budget as well. I'm trying to think what else I've missed. I probably have gone on too long here, but I think most importantly, I certainly recognize and we discuss it every year, and I know we make little steps forward with it. And I was happy to hear Dane talk about Human Services looking at the increases for especially our mental health community workers to get us in line with other states, but as well as other mental health resources within our state. And as I said, we have an opportunity here, and especially after the incredible year of what you all have done. And like all who have spoken before me, it is amazing what you've accomplished, and at your own risk to do what you've been able to do in our community, and it is so appreciated and honored, the services that you've given to our community members who have been most in need of help. So I will end that there, and thank you.
Thank you, Mary. Thank you very much. That sounds like a good time to end too for us. Dick had to jump off, so we'll catch up with him later. But I really appreciate the time that you've spent with us this morning. Appreciate your words and your support. Any support that you can provide us and the system of care at your committees or in the legislature will be much appreciated. Thank you so much, and stay safe, wear your mask, and give us a call if you have any questions or need anything from us. Thank you all very much.
Thank you.